Yeah, Jonathan, it's really incredible that we are here now sitting where we were last year at this time, after all of this time in this pandemic. And it is discouraging.
For me, working in a children's hospital, from my perspective, I just don't want to have to put another surgical breathing tube in another child with this disease. I don't want to see another child admitted to the hospital with COVID-19.
So there are plenty of places in the country where there are high positivity rates still. And I would be much more cautious about bringing a younger child in contact with a large number of people if there's a really high transmission rate.
You know, the environment of this pandemic is shifting. It's not been static this entire time. It's been sort of an evolving organism. And we're seeing that now with the increasing numbers of pediatric cases.
So joining us now is Dr. Susannah Hills. She's a pediatric airway surgeon and the author of a recent CNN op-ed warning of complications in COVID cases that she is personally seeing in children. Doctor, thanks so much for being here. So we just showed that graph of the number of cases in kids that has just gone up. I mean, you can see it in the graph how exponentially it's gone up. What are you seeing on the ground in your hospital?
Well, I've seen the whole spectrum of how COVID's affecting kids because I'm an airway specialist dealing with a whole range of kids. So I see some asymptomatic children. I've seen children come back to me months after having had COVID with symptoms, and I'm called on to take care of kids in the ICU who are on ventilators sometimes.
So let me just stop you there because, I mean, we just don't, obviously when this all began, we didn't think that kids would be sick enough to be on ventilators. Right. And so the kids that you're seeing on ventilators, how many are you seeing? And are these kids with underlying conditions or were these previously healthy kids?
Well, we know, and in my personal experience, it's been the case that the majority of kids that I've seen get really sick have been kids with other illnesses as well or comorbid conditions. But now the difference with this Delta variant is that we're seeing also kids who may not necessarily have comorbid conditions also end up in the hospital with illness.
Welcome, Dr. Hills. So Pfizer's early data studied 2 vaccine doses. What did that early data say about exactly how effective that was?
Well, the key thing, Lana, about the data was that it showed that the doses were safe. So there were very few negative side effects. It was a very safe thing to be administering. However, they found that a 2-dose regimen just really wasn't very effective in mounting the kind of immune response they were hoping to get, the kind of immune response they were getting from 2 doses with the older age kids that had already been getting the Pfizer vaccine.
Give us your 30,000-foot take on this, your broad overview about the latest situation with the virus.
Yeah, Jonathan, it's really incredible that we are here now sitting where we were last year at this time, after all of this time in this pandemic, and it is discouraging. Positivity rates are now up 7% in the last week across the United States. 69,000 Americans are hospitalized right now, and over 20% of our ICU beds are being utilized for COVID patients. So it's really concerning. And my concern is that the healthcare system is really going to be under intense and really possibly unbearable pressure in the next few weeks. The bottom line is that those people who are hospitalized are nearly all unboosted individuals. So I just have to urge everybody who is unvaccinated and unboosted to go out and get their vaccinations, because that is the way that we're going to get through this.
We know that kids' vaccination rates are remaining low with their huge disparities around the 5 boroughs. But in terms of masking, there are some parents who are really in the camp of unmask our kids, and there's a whole slew of parents who say, no, it's the only thing we've got. What are your thoughts on the mask mandates?
Yeah, so I think it absolutely depends on one of the factors you just mentioned, which is our vaccination rate. We're doing much better amongst the older kids, those 13 to 17-year-olds. Our rates are around 78% for vaccination across the city for that age group. But the younger kids, those who are under 13, the 5 to 12-year-olds, we're only at about 41%. So that means that our younger kids, most of them, the majority, are at risk, and masking may still be very important for those kids.
Today in New York City, children 5 to 11, they're starting to get their shots at these city-run sites, even their schools. You work with kids every day. How big of a step is this? How important is it going to be to get these kids vaccinated at places like their school?
Yeah, Craig, it's huge. Right now, that 5 to 11-year-old age group is accounting for just over 10% of our infections in the United States. So again, thinking about how are we going to get control of this pandemic, how are we going to protect our kids, getting this group vaccinated now is really important, especially as we're headed into the holidays. And I think having that access to vaccinations at schools is really critical. There are a lot of communities where access is challenging. A lot of pediatricians' offices are going to have to wait to get deliveries of the vaccine, and they may not be immediately available. So having that access in schools, I think, is incredibly helpful to kids. And I think that parents, I hope that now they're really thinking about it, considering it, and making a plan to try to get their kids vaccinated when that opportunity may come to their school.
What advice do you give patients, or would you give someone in an area with high community transmission but no mandate on masking right now?
Yeah, well, no matter what I think, right, this is happening. And you hit the nail on the head right there by talking about what the local transmission rate is. That's the key. People need to really look at what their local rates of infection are, what their local rates of positive tests are, in combination with what their local vaccination rate is. It is different for somebody living, for example, in Alabama, where the positive test rate is above 30% right now. Vaccination rates just barely hovering at 50% versus another state where infection rates, positive test rates, like New York, New Jersey, are approaching 5%, lower than 10%, with vaccination rates above 70% or so.
What's your take on kids getting vaccinated? Is it a good idea?
A fantastic idea. This is just the news that I've been waiting for, that we're beginning to be able to get more children vaccinated. And for me, working in a children's hospital, from my perspective, I just don't want to have to put another surgical breathing tube in another child with this disease. I don't want to see another child admitted to the hospital with COVID-19. It's rare, but it is still happening.
Dr. Hills, as a pediatric airway surgeon, have you witnessed any symptoms or complications due to COVID-19 in children specifically that needed the attention of your specialty?
Oh, absolutely. Yes. I have unfortunately lost patients to this disease. So children can get very sick with this illness, even though it's rare.
Dr. Hills, your initial reaction to the administration's plan, what do you think?
I think it's really smart to have a plan to set things up in advance to be able to give these families access to this vaccine. It's one of the major gaps we have in our coverage right now, this pediatric population.
Dr. Hills, great to have you here. So assuming this actually gets passed, do you think that it will be a challenge to get a large number of kids vaccinated? And the reason I ask is because at the moment, we can put up our latest graph, roughly half of young people aged 12 through 17 who are eligible are actually vaccinated. So do you think it will be harder to get younger children vaccinated, easier? What's your thinking?
Well, Allison, I think it's perfectly natural for parents to have questions. It's normal to have concerns. And that is likely why the numbers that you just put up are what they are. We're not quite at 50% in terms of vaccinations for kids, for adolescents who are in that eligible group yet. But some areas are doing really well. Some areas have 70% or more of their adolescent population who are eligible vaccinated. So I think the key here is to anticipate these questions and to invite these families and parents in to see their doctor, to see a trusted source, to ask the questions and get the good information that they need so they're ready when the vaccine is available, which we anticipate that it should be, hopefully.
It can be so tricky for kids to understand what's going on here. If you're a parent and you've decided you want to vaccinate your child, how should you talk to them about the vaccine that they're receiving?
That is such a great question. I think really being honest and upfront about why you're going to the doctor or the clinic, telling them they're going to get a vaccine, letting them ask questions. Kids have really smart questions too. So asking or allowing children rather to ask questions and giving them information is so important. I think also explaining to them that they're protecting themselves, explaining to them that other kids are getting sick and they want to protect children around them is really helpful. And then coming up with a plan so they have a little control over the experience. maybe allowing them to pick something comfortable to wear or to bring a game or a stuffed animal or something that will help keep them comforted, and rewarding them in the end for being brave and for facing their fears potentially of getting a shot. All those things are really helpful.
Yeah, our deal at my house is a bag of gummy bears when it's all over. So that's the bribery I'm using, and that's all they need. Thanks so much, Dr. Susannah Hills. Really nice to see you this morning. Thanks.